If body weight drops, walking can feel easier first, but that does not always mean recovery is improving too. On Ozempic or Mounjaro, appetite often falls before fitness improves. So if exercise starts feeling strange, the problem is often not the drug itself. The problem may be that your body is trying to do the same work with less food and less fluid. That is why two people can start the same drug and tell opposite stories. One says stairs feel easier within days. The other says a normal workout suddenly feels flat, heavy, or oddly hard. The difference is often not motivation. It is whether food, fluids, and training still match the body they now have. Weight loss itself can make movement feel better early. Less body weight can make walking, knees, and stairs feel smoother. But these drugs also lower appetite and can cause nausea, vomiting, diarrhea, constipation, or dizziness, especially after a dose increase. So easier movement does not always mean your body is ready for harder work. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. When exercise changes on these drugs, the first mechanism is usually simple underfueling. You are asking your body for the same work, or more work. At the same time, you may be giving it less water, less protein, and less total energy than before. That problem can stay hidden at rest. Then a workout exposes that underfueled state. The type of exercise matters once that happens. Steady walking often improves sooner because pace is easy to control and body weight is dropping. Hard intervals, long runs, and heavy lifting often feel worse first. They demand more fuel, more fluids, and more recovery than many people realize. Part of the difference is mechanical. Walking gets easier when there is less body weight to carry. Heavy lifting and faster cardio depend more on stored energy, hydration, and recovery. So a person can feel better in daily movement while feeling worse in training that asks for more output. A common misunderstanding is that weakness during exercise means the drug is directly destroying muscle right away. That is usually not the first explanation. The more common explanation is that intake fell faster than the routine adapted. In most cases, the workout is exposing a fueling and recovery problem. Weight loss is also not pure fat loss. Some muscle can be lost along with body fat, especially if protein is low and strength training disappears. That does not mean exercise is the problem. The real problem is getting less fuel, less fluid, and less rest while asking the body to keep performing. Some people feel lighter, assume they are healthier, and then train harder while eating less than ever. They use exercise as proof that everything is fine. In reality, the workout may be the first clear sign that recovery is already breaking down. That is why early comfort can mislead people. A lower body weight can make movement feel smoother, but smooth is not the same as fueled. If you add intensity too early, problems can follow. The body may feel better for a moment, then it can feel worse a few days later because meals, protein, fluids, and sleep were never stable enough. Some groups need more caution. If you have diabetes and also use insulin or a sulfonylurea, your risk of low blood sugar can rise during exercise. A sulfonylurea is a diabetes pill that pushes the pancreas to release more insulin. In that setting, shakiness, sweating, weakness, or confusion deserves faster attention. Older adults also need more caution. In that group, preserving strength and daily function matters as much as losing weight. A younger person may tolerate a rough week and recover quickly. An older adult may lose ground faster if protein is low, fluids are poor, and strength work disappears. In those higher risk situations, the signs are usually practical, not dramatic. Easy effort feels too hard. Recovery takes much longer than expected. You may feel dizzy when you stand up or get headaches during light sessions. You may also finish a workout with no appetite and no realistic chance of eating well afterward. Daily function can also warn you before the gym does. Getting out of a chair may feel harder. Carrying groceries may feel more tiring. Your workout log may not look terrible yet, but your body may already be telling you that strength, intake, or recovery is slipping. Severe symptoms should not be pushed through. Repeated vomiting, severe belly pain, clear low blood sugar symptoms, or obvious dehydration are signs to stop and reassess. In many cases, the workout did not create the problem. It simply made the problem impossible to ignore. Match the workout to the body you have right now. Early on, consistency beats intensity. Short walking sessions, lighter strength work, and repeatable routines usually work better than chasing your old performance too fast. A simple rule helps here. If the session lets you hydrate, eat, and function normally afterward, it was probably reasonable. If it ruins the next meal, triggers hours of nausea, or wipes out the next day, it was too much. That is true even if the session seemed normal on paper. Recovery often fails after workouts because meal timing and fluid habits do not adjust fast enough. Breakfast gets smaller, lunch gets delayed, and fluids drop, but the training schedule stays the same. Small planned meals or snacks often work better than waiting for hunger or trying to eat one large meal after training. Fluids matter for the same reason meals do. Low fluids make exercise tolerance worse and make recovery harder. Dark urine, dry mouth, and a sudden drop in exercise tolerance can be useful clues. Rough symptom weeks raise that risk even more because nausea, vomiting, or diarrhea can quietly drain fluids and calories. In rough weeks, the body gets less forgiving. During dose increase weeks or rough symptom weeks, keep the sessions easier and change one variable at a time. Push harder only during stable weeks, when meals are going in well, fluids are steady, and recovery is predictable instead of hopeful. Two practical parts of that prevention plan are enough protein and sensible strength work. Low protein makes weakness more likely during weight loss. Strength work helps protect function while the scale is moving. Keep it hard enough to help, but easy enough to recover from. A simple weekly target is enough for most people. 2 muscle strengthening sessions each week is a reasonable goal for many adults. Simple walking or other basic movement can fill the rest of the week. The goal is not to turn every person into an athlete. The goal is to keep the body useful while weight is coming down. Exercise on Ozempic or Mounjaro can help, but only when the routine matches the new reality those drugs create. The key issue is not exercise itself. It is whether food, fluids, recovery, and progression still match the work you are trying to do. If workouts feel worse, that mismatch is the first place to look. Medicine, simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor. Bio.